My name is Todd Sevig, and I'm director of our Student Counseling Center and one of the co-chairs of the conference. And we hope that you had a great afternoon yesterday and evening, and our invitation that we spoke of yesterday continues throughout the whole day today. I'm very happy that the conference committee ordered a lot of sunshine for today. So for those of you who may not be from Michigan, we endure many days of cloudiness this time of year. So it's nice to have the sunshine, matched only by our smiles, I guess, today as we go through today. So we're very happy to continue this theme of how do we navigate student mental health on campus in a hybrid world. And we're very happy to have our opening panel today. And I'm going to just briefly introduce the panel, and then we'll just jump into it. I have three wonderful colleagues to my right here from the University of Michigan. Lindsey Mortenson, who many of you heard yesterday, who is our Chief Mental Health Officer and Associate Executive Director of the University Health Service. And to her right in the middle, Jo Desprez, who is Director of our Wolverine Wellness Unit, which is our wellness unit on campus. And on the end is Jen Burch, who is a Senior IT Project Manager and has been really instrumental, especially the past year and a half, I think, on helping us kind of navigate all these technology products, if you will. We all know that it's constantly in the news. We use them. We get a lot of emails about them. I'm sure some of you get the Daily Chronicle of Higher Education emails, and just this morning there's offering a program on how technology is going to influence academic advising. So I'm just really happy to have this discussion with us all and the panel and offering what you all know, and then we'll take it from there. So thank you very much.
Good morning, everybody. Thank you for being here. A quick note on logistics. There are some note cards that are being passed out for questions, and then we'll also have a mic that's available for questions toward the end of what are about 15 slides this morning. And we very much hope that today will be a conversation. One of the themes from yesterday in the keynote discussion was that we're out on the leading edge here with a lot of digital mental health and well-being products, and we're all still learning together. So we really hope that this panel talk today will stimulate some questions for you and that we can all learn together. One of the strengths of this conference is the diversity of people who are here in different roles, from students all the way up to R1 researchers, vendors, investors, foundations, and so we would love to learn from you and look forward to your questions. So keep them coming, and we'll get started. So I want to make a connection to the keynote talk yesterday that I gave, and the focus of the talk yesterday was why do we need a digital mental health strategy? And one of the most important things is people. And I think why we're all here is we're all here in service of students, faculty and staff here in higher education. And I'm excited for this panel today because we're going to shift a little bit to the what. Talked about the golden circle of why, how, and what. And I think our experience is that a lot of these conversations about digital mental health or well-being products start with the what. So we get a lot of details about the products, and then we start asking how and why later. But what is an important question? And I want to just rewind the clock a little bit to talk about how we got here and why we thought this was an important talk for the conference this year. So I think on our campus, when the dust settled a bit on the real crisis period with COVID, we were able to turn back to the important work of two mental health task forces on campus. One of them was the Rackham Graduate Student Mental Health Task Force, and the other was the Student Mental Health Innovations Task Force. And there was a lot of engagement on our campus through those two task forces. And the moment I think that many of us had was as COVID was starting to wind down a little bit, we thought, how can we take everything we've learned through COVID about public health and public health informed approaches to our work and apply it to mental health? And how can we shift the conversation on our campus from talking a lot about, and I say this as a psychiatrist and as a somebody who is involved in the operations of a major, the health unit on campus, how can we shift the conversation away from being entirely about services and health services, which are on one end of the continuum, but are not the entire continuum. And I'm really proud of the work that we did on our campus to develop a care continuum framework that is now being really well socialized on our campus and has given us a different way to talk about our work. And this is it. So for those of you who are work in the public health space, you know that this kind of triangle of primary, secondary, and tertiary prevention has been around a long time, so there's nothing novel there. But what we really needed to do on our campus to shift the conversation was not only to catalog all of the different services within each of these different layers, but we needed to give people a way to talk about it. And I'm really proud of this diagram and the way that it is shaping conversation on our campus, because now, for example, when we start talking to vendors or talking to each other about some of the shiny new objects out there that I talked about yesterday, we have a way to talk about it. Is it clinical? Is it non-clinical? Is it in the primary part of the prevention spectrum? Is it secondary? Is it tertiary? Because as you can see, my lane on campus is mostly at the tip of this pyramid here, which is on the clinical side. But those are the less intensive interventions typically in terms of the ones that all students need. Most students need what's at the bottom and in the middle here. So I wanted to share this framework with you here today because it is part of the way that we have started to kind of figure out and sort through all of the different digital mental health and well-being products that are coming our way and showing up in our inboxes every day. And so with that, I'm going to turn it over to Mary Jo.
Thanks. And one of the things that we found ourselves talking about when we first started to meet for this session was just how many of us receive emails about the next best thing that's going to solve the problem. Literally, I think sort of in my position as the director really working in health promotion, I probably get 1 to 2 a week of a new product that is sure to, and can I please schedule time for an hour preview, right? And then what we found out is that's actually happening across campus, and it's happening at the individual college level. And so really trying to have a strategy that can help us navigate this. So the stars on here do not represent any true data points other than my own anecdotal, how do I feel about the kinds of things. So if you think about the lower level, those are the kinds of products that most often come into the, whether it's a self-care, it's a coaching kind of thing, it's non-clinical. And then we talked a lot about sort of then the more clinical or telehealth technical application. So I think it's also really important to, when you're doing this on your campus, to think about the continuum of care and to think about what technology supplemental resources support the continuum of care, what's out there. I think we learned a lot about how it improves access, but we also hear in the health promotion space how the overuse of technology can also have mental health implications, and so making sure we're really thinking about that across the entire continuum. So Lindsey referenced one of the task force that was that came, and it was. I want to just talk a little bit about this task force because it was unique. It was called the Student Mental Health Innovative Approaches Review Committee. I know that's a mouthful. What I would say about this committee, though, it was charged from both the provost office and the vice president for student life. And it was one of the rare committees that really had our academic partners and our student life partners at the table. And one of the things this committee said is that we can't keep trying to solve problems in solo buckets, and that mental health and well-being is often connected to bigger other things, right? And so what I think is really important for you to know is that the why is that we want to become a health promoting campus. And that 4 big themes came out of that task force. And what's really important for you to know is that there were technology recommendations in each of those 4 buckets. And so I think sometimes even when Lindsey was talking yesterday, for me, the digital strategy is so important, and this alignment with what are the institutional priorities, which way are we headed. So I'm not going to go into detail. There is a link for the entire report, but you can see sort of the technology recommendations. Long way of saying that is how I got to meet Jen Burch. Because one of the things that happened is that we really stood up some working teams, and one of the working teams from that report was the technology working team. Living in sort of in spirit to the original committee is we made sure that it was multidisciplinary. So we had academic folks there, student life folks there, content area experts there, and IT folks there. And so this really is a snapshot of what we did. And I think this particular kind of working group is able to be replicated anywhere. You don't need the task force, but to start to bring people together to really look at how do we sort of understand our own horizon for us at a big Research One university, and how do we start to like wrap our arms around that. So you can sort of see we had 3 major things that we were doing. We were doing work team support for all the other work teams because, as I said, there were technology recommendations in the entire report. We were also looking at well-being resource management. So we had to develop a process for the identification and the active management of what's out there. So we had 15 plus separate different products on campus, and we're still learning about new ones all the time. And in fact, we had different parts of campus in a contract with the same vendor that didn't know about each other. So that developing a process, and then developing a process for the intake of new ideas, right? So how do we help when all of us get these emails that say we have the next best thing, to actually have a process to take them in, evaluate them based on all of the kinds of things Jen's going to talk about in a little bit. And then we were also sort of, how do we help the institution pilot new things? And that really was in the IT solution space. This is a great reference article. It's here, but one of the reasons we wanted to include it in the panel is that key considerations for adoption and implementation, which is sort of different than the why, but this is from the Deploying Digital Health Tools. This is really about health systems and complex health systems, but I think there's some really great wisdom here that we can use sort of on the campus side of things. And so the product selection, one of the big points of that particular one is, before we decide that, what else is on campus? So I would say the thing that helped us the most is identifying everything that already happening on campus, and is there any currently existing technology or product that could add on and do the thing you want to do? Does it have to be another contract? The financial value, Lindsey's going to talk a little bit about this, and she talked about it yesterday in her keynote, of the cost of something, the price of something, and the value of something, and how much time does it take, what is it solving for. The clinical value, what is the gap, what is the reason that you think you need it on your campus. Third-party folks or innovators, we have a lot of student innovation on campus, will tell us why we need it. This is what we can do for you, but I think it really helps for us to say, what do we need? And the continuum of care was really helpful. Data assets. Many of the vendors require some data to do the thing they say they want to do. Can the university actually provide that data so it can operate the way that the product says? An internal champion, right? To have somebody just keep moving forward when all the other things come through. Is there somebody on campus who is the internal champion who can navigate that? The executive sponsor, this is what levers do you need to really think about how do you finance it? How do you finance it, and how does it fit into sort of some of the other institutional priorities that are happening? Then the implementation, and this is no small, it's like it's one little bullet point, but it's like a gigantic bucket of work in terms of how do you launch it? It's only as good as if people know about it. And then sort of the technology background before, and then the long-term home. Most of these things require that not only does it's like new and shiny, and then you pilot it and you're getting some data, but it has to have somebody taking care of it on a regular cadence and still making sure it is the right thing in this moment in time. And things change quite rapidly, and so knowing that. So we wanted to share these key considerations from this article because they actually have played out in terms of how we're doing this here. And then we just thought that there is so much new in the digital technology space, but one of the places that's actually been in place for a while is sort of the ed tech online course space. And many of you may use an ed tech online course where you require students to take an online course. But I think we were hoping that just thinking about sort of the wisdom of that longer term project is also helpful for us. So the campus need in the gap was to try to get information to students regarding substance abuse and sexual misconduct prevention, and do it in a way that they could actually think about it as they transition to coming to a college campus. So that sort of was the need. And when you do it at orientation, in addition to all the other things, it can get lost. So what we're also trying to do is there a way to give them some online learning in the transition space that they could have before they even step foot on campus? It had to be customizable for Michigan resources. It was also solving some compliance requirements. And the legal landscape has changed. Drug-Free Schools and Campuses Act hasn't changed that much, but if you think about the sexual misconduct legal landscape, that changed quite a bit. And then we also were looking for something that could actually tell us, was it doing what we wanted it to do? Was it providing shared language? Was it helping people understand some of the basic foundational definitions? And was it starting to point to policy and resources that students could use once they got to campus? So that's really what we were looking for. A couple things that it became increasingly technical. How we implemented it and to how we implement it now. The technical requirements on the campus side really got more, I was gonna say technical, really got more, complicated. So we, in fact, as part of the student mental health recommendations, actually hired an online technology platform coordinator because of the increasing complexity of that work. We also just think it's important to remember for our particular is that when you are engaged with a vendor and that vendor company changes, it gets bought, it changes, it disperses, that has an impact back on campus. And so asking those questions, how long, what is that landscape? Because when in our particular example, a new technology platform was used, which required us to adjust and transfer to a new platform, which it was pretty consequential in terms of the amount of time that took. The other thing is the contract renewal considerations. One of the things to do is in those spaces, stop, take a deep breath. Is it still meeting the need? You go back to what are the additional needs? Is it still sort of in that meet our financial cost, value, price considerations? The other thing I think in any of these EdTech online courses is that you have content area experts who are doing things in this space all the time. They're doing it in person, they're offering the programs and services, whether it's non-clinical or clinical. Are they at the table to help you evaluate? I can't say this enough, student engagement and feedback all the time. We talk with students before we engage with the vendors. We talk with students as we're looking at the ones we're choosing from, and after they've done it, is this still meeting the needs? So student engagement and feedback, and then again, the long-term home. Just in the 10 years that we've used the EdTech, it has lived in 3 places on campus. So finding a long-term home that makes sense was also important.
So I want to talk about the top of the pyramid that I shared at the beginning a little bit, because I think that the introduction of all of these new clinical mental health programs is exciting and it's challenging, right? It's 2 sides of the same coin. So you'll hear me express both optimism and excitement about the way that it improves access in particular, but you'll also hear me talking about a little bit of concern and some of the non-technical categories of concern for clinical products are things that I talked about yesterday, and will be no stranger to those of you who do clinical work, right? It's quality, expertise, so that the level of subject matter expertise and training of the clinical staff who are working at some of these companies, safety, access, and the patient experience. And I wanted to share just these 2 quotes about accreditation in particular, because I think it captures something important. So on the one hand, accreditation, this top quote speaks to, there's a pretty strong evidence base that accreditation can improve quality, safety, and access. And this is really important in healthcare, right? Because first and foremost, we don't want to do any harm. Of course, we hope we're going to improve quality of life, but first and foremost, do no harm. On the other hand, I found a more recent article that talked about some of the drawbacks of accreditation. And for those of you who have been through the accreditation process, it is painstakingly detailed. It takes a lot of energy and a lot of work and a lot of people. And it does, I think, overall make your organization and your work better. But one of the drawbacks that this author highlighted in the JAMA article is that there's some evidence that accreditation sometimes creates a little bit of drag on the patient experience. And some of that is just related to, it's probably more in the hospital setting than it is in the outpatient setting. But it can sometimes feel like there are so many requirements that you're constantly checking checklists, right? That you lose sight a bit of the patient experience, which is incredibly important. In my own work as an administrator, I talk a lot about the student experience and the staff experience, and they're both important for the health of an organization. So my experience is mostly with AAAHC, which some of you may be familiar with. It's one of the major accrediting bodies for outpatient or ambulatory healthcare organizations. Some of you may be more familiar with the Joint Commission. And in the counseling world, there's IACS. One of the things that I think is really shifting and needs more discussion is the role of accreditation for some of the clinical online services. And there is an accrediting body for telehealth services, but the awkwardness of accreditation right now is that some of the clinical vendors, and we contract with one of them, who are offering virtual online counseling, describe themselves fundamentally as an ed tech company, which Mary Jo highlighted. And so in talking to my colleagues ahead of the rollout of the virtual counseling service that we recently contracted with, I have sort of described it as a clinical service sitting on top of an ed tech platform. Now that's not all of the vendors, that's just the particular vendor that we're working with. And of course, one of the things that's so exciting about it, I think, to students is that it's kind of like the Uber or Lyft of clinical mental health services, right? Like the genius of some of these services is that they pair the customer with what they want extremely efficiently. And I think there's a ton of value to that, right? So the fact that our students on our campus now can go onto their phones or their computers and within 2 minutes register with the sort of a minimum sufficient necessary amount of information for, emergency contacts and demographic information, and have an appointment in less than 2 minutes is astonishing. I mean, that is really revolutionary compared to, again, I talked yesterday about the bricks and mortar model that we have been in for so long, and even in my 10 or 13, 14 years now here at Michigan, is really, really different, right? So this frictionless, quick access way of getting care is wonderful. And for all of these platforms, I do have concerns about quality, safety, and expertise, right? Because the operations part of me always wants to know, what does the policy and procedure manual look like? Who are you accredited by? Show me your clinical leadership team and who's in charge if something goes wrong. Talk to me about care coordination. I think one of the, and I think we'll get there. I think we'll see more, hopefully, groups looking more seriously at accreditation or new ways of accrediting some of these kind of hybrid clinical ed tech companies. But I think there's a lot of work to do, and I hope that I hope it's maybe can be a topic of conversation for today, because it's a growth area for sure, and it's an area that requires a lot of partnership, right? So Mary Jo talked about these products having a home. That's been really important for us, as we have recently partnered with a virtual counseling company to know, okay, where does this platform sit within the organization? Who are going to be the primary points of contact? And if something is not going well, or we have a student of concern, what are going to be the pathways to working through that? So I want to highlight this because I think in mental health, because mental health is so fragmented and there are so many disciplines, I mentioned this yesterday, the quality framework looks really, really different. And I will say, in my own medical training, and this is changing, I did not get a lot of quality training. I've had to really seek that out separately on my own. I've learned a lot, but I think that this looks really different within medicine, counseling, social work, licensed professional counselors, health education. I think we all approach this differently, and that's a risk, right? When we cannot all agree on what quality looks like, it makes it hard to get together and evaluate a new product, because we're not all going to agree on quality. And if you remember what I talked about yesterday, the definition of value, right, is quality over cost. If we cannot agree on quality, we cannot agree on value, and it's going to make it challenging to evaluate some of these products. So I want to resurface this quality framework, because within even all of these different accrediting bodies I mentioned, they define it differently. So I think there's some work to do to decide what we care about when it comes to quality care for students. And with that, I will turn it over to Jen.
Thanks. I was trying to bite my tongue on a few things, but I think I'll talk about them here. So first, I'm just going to show you that I'm still learning quite a bit about what is and is not regulated in this space, but I attempted to take my information that I've learned from numerous articles and papers and try to just put that in a visual here. This is not based on any data. This is just my visual representation of what I'm finding in that area. And if you notice the darker blue color, we're next to clinical, which is regulated, there's this sub little section of medical devices. Now, software technology areas that are considered a medical device may have to go through FDA regulation, maybe. There's also opportunities to bypass that. So you can file paperwork to actually get around that if you don't deem it, that it warrants that sort of regulation. Everything else in that green for mental health as applications, those are not regulated at all. So tread lightly, and I'll talk about that in a little bit here. It is a space that is kind of open for people to be more responsible about not only procuring it, but also using it. And I think it's going to get into a space where we'll have to share information with the folks that are using those technology items to say, this is what's happening with that information. Here's how it's being used. Here is any data sharing that might happen with that, and we want you to be comfortable with it, much like you do today with HIPAA, where you share any information with patients. We will probably find that we're going to be doing something similar with the technology that we're giving people to use and trying to help them out. All right. So I think the easiest thing to really talk about here is I always try to explain tech as just another tool. It seems like it's going to solve a lot of problems. People get really excited. There's always that really awesome salesperson who comes in and says, no, we've totally taken care of that. I know exactly what the problem is. We've got these experts that are on our board of advisors. They all know everything that's going on. We've taken care of all those problems. That's great. They're salespeople. I've been in the tech industry for over 24 years now. I've actually helped salespeople out, and I will tell you that they know how to make it look as if, and they will even mock up different types of systems to look as if it's doing the things that they're trying to sell you on. It's not always the case. It's a smoke and mirrors kind of activity. Now, they may actually be planning to do something that way, but that doesn't mean that it's actually functional right now. So you will be going into engaging with technology as something that you have to do a little bit of legwork. You need to know what are the risks of that particular application. Is it something that is more on the clinical treatment side? In which case, I think you may find that you want to be more engaged and involved directly with the patients using it than just handing them an app or recommending something and saying, go run with it. If it's something that's a little bit less, like maybe I monitor my sleep. I have these apps on my phone and my watch where it monitors my sleep patterns. Those are a little bit more, safe. It's on that spectrum, and I can always have my doctor take a look at it if needed, but more often than not, it's not going to get me in any trouble by looking at my own information. Now, mentioning the company before that just bypassed FDA regulation, there is actually a CBT app out there on the market right now for substance abuse that did not have to go through any regulatory bodies. It's out there, it's widely used. It's been found that there were biases in the case studies that were used for their clinical trial information. It's been found that they actually have some bias in the technology itself, which I will talk about in the next slide here. But just know that you need to go in there and look at things a little bit more up front, maybe even try and test things out before you decide to move forward with it. For us, particularly at the University of Michigan, we know that technology, we want to give people the ability to go fast. If it's a need, it needs to be done right now, go quickly. If it's a small expense, low risk item, go ahead and purchase it. Unfortunately, we're finding that some of these vendors in the well-being space are actually offering very low-cost applications and technology services that don't have that regulation, that's super cheap in the grand scheme of things, and a unit can purchase it themselves without necessarily having to go through a procurement process, any type of checklist. They can just pull out what they call the P card and go ahead and buy it and pay for it and roll it out to some students. You're going to want to know some way of getting in front of that to do some vetting. And we are working on that right now, trying to figure out a community of practice and some networking with folks with an interest and in this space to be able to start cataloging things that are being used today on campus, as well as engaging with folks that may be pursuing purchasing anything so that they can come to us and say, has anybody else already done this? Are you already using this system on campus somewhere? And can I learn from you and what your experiences were? Or maybe we can work together to do some sort of renegotiation of the contracts at scale. But there is a need for us to try and just still be cautious in that space and talk to people before you just put the credit card down and buy something. You do want to pay attention to the obvious things in data. We all know that there are certain types of sensitive data that we want to try and pay attention to. The obvious ones are always PII and PHI. For campuses, we also have FERPA data for the student information. Where we're getting into now, though, isn't those obvious ones. It has a lot more to do with vendors sharing information. So Google's not the only one that uses your usage and your information and shares that out to folks. Some vendors will actually resell information on people's usage, okay? Now, most of the time it has been de-identified, it's anonymous information, but it's still information about a population, such as your campus, that they could then turn around and sell to someone. Another research group, another body, another company, but they are doing that. They do have to disclose that information to you, so when you're doing the contracts, you will want to take a look to see if they are doing something with the data that they're collecting and exactly what data that is. Now, I know that for the university, the larger scale contracts, we tend to be more cautious. We either have co-ownership of the data or we have the ability to come in and say, it's our data. And if it gets to the level of an OGC review, it's our data. Vendor can try and negotiate all they want, but we're a little bit stricter in some areas, rightfully so. But again, when you're talking about some of those discretionary funding expenses, those smaller scale things, they don't go through those same bodies. So it's up to you to try and look at that contract information to say, are they using it? How are they using it? What can I do to try and get around that and maybe have a conversation with the vendor? We're also getting into, and this is something that's come up a lot recently, data retention policies. So not just how long do they store the information in the data, but also who owns it in terms of if I open an account with one of these applications today and I've been using it, or let's say I didn't use it today, I opened it up a year ago, I've been using it for a year and it's decided that it's not working for me. I'm going to go ahead and delete my account. We don't know if my data is being deleted as well. And that is something that some vendors will actually retain the information indefinitely, depending on whatever their data retention policies are. You may not want that, depending on, again, that level of risk, the sensitivity of my information in that system. We may want it to be very explicit in those contracts that when I cancel my account, when I delete my account, my data is deleted as well. Now, you will probably have to talk about that in procurement processes with vendors. And that is something that I think is, there was actually legal work happening here in the past year where a group was keeping information even after the accounts were deleted. Most people assume that if I delete my account, I'm safe and I'm no longer associated with it. That's not a good assumption anymore. Make sure you're paying attention to that one. The opt-in, opt-out is a new trend in technology. I say new, it's actually been in some systems for over a decade now, but this ability for a user to be able to do some things with the technology, but not allow the vendor to store more than is absolutely necessary for being able to get the right information out of it or to make it effective. So some of the less clinical information or some of the less clinical systems, we're trying to encourage some of our vendors that we're even working with to give the students the ability to say, I don't want that. I don't want you tracking any of my stuff. I don't want you to have any ties to me whatsoever, and I want to opt out so that I can still use the tool to get content and information that's available to me, but I don't necessarily want to take advantage of some of the other things that would require long-term data retention and knowing what I'm doing in the system. So keep an eye out for that. If they don't, when you're procuring something, if they don't have that option explicitly stated, you might just want to ask. Some of them may not be able to because it's necessary to be able to use that information to be able to do the delivery that they're trying to do, but it is possible. And I think some groups will try and make an effort if they're very serious about protecting the people using the applications, they'll try and make an effort to give them an option to try and take some of that information away. I think Lindsey mentioned this one a little bit here ago too. This is a big unknown for me right now, and I think I want to even talk to some of my colleagues in information technology services. We're in a space now where most of our vendors that we're working with are using platform services and data services with a third party. Amazon, Google, Microsoft, they're all there as the big core infrastructure providers, and then vendors are layering their solutions on top of that. Now, in some cases, we have contracts directly with those vendors in addition to contracts with the new app vendor. And I'm unsure how ugly that is going to get if those contracts haven't been fully vetted to see, in the event of a breach or some other issue, who's responsible, which one takes ownership. I would hope that we're still safe regardless, but it's a big unknown right now. Plus, we know that to some extent, even if the vendor is saying that they're doing something, we have to trust that their platform provider is also fulfilling that as well, and that there's some sort of crosses and checks and balances there. It's I know that there is some work being done in this space, and I am definitely not the expert to talk about it right now, but I think this is an area that we will probably want to inject some sort of checks and checklist items with our teams to say, if you're going to procure something that is not self-hosted, check it out, look at the contracts and see what kind of arrangements they have with those parties, such as Amazon or Google, or even another third party besides those. But those are the three big players right now. We can actually show you the link here, but you'll notice that there's a link for an intake form example. This is what Mary Jo was talking about a little while ago, about trying to calm the bleeding. I wouldn't say stop it, but try and calm it with the influx of vendors. We knew we needed to start somewhere, and we needed to give our colleagues on campus an out as well. It's as easy as just trying to say, you know what, don't necessarily stress yourself out about answering all those emails. Here's a place for you to send them. So we went and created just a simple Google form that has some questions in it, has some of our common things like, do you have sensitive data, or do you store any sensitive data? Do you have any accessibility, like the SOC 2 compliance, accessibility compliance for ADA? Have you been working with any sort of peer-reviewed research to base on your application on? I mean, there's just some basic things in there, and we can definitely share the link with folks, but it's definitely not perfect, but I would say it's a good place for us to start and try to help our campus colleagues get through the crazy, because I get vendors, not quite as much as Mary Jo, but I still get them at least a couple of times a week. And it's a nice way for us to just say, you know, thank you for your interest, but I need you to go here first. If we decide to follow up with you, we'll be in touch. And there is automated responses to it as well that, depending on how they answer, we might just not do anything. Thank you for your interest and your willingness to support us, but we've decided not to go further. But it's a good way for us to just kind of step away from it a bit. All right, this is the biggie. And I'm chuckling here because I know that we have experts on campus who are I mean, this is their research. This is what they do. They're great at it, right? I try to simplify it down into really easy terms. You know, I am certainly not the person who's doing the research in this space, but I've worked on a number of projects that are actually involved in this technology right now, and it's a huge spectrum, right? But I try to explain it in simple terms of, imagine AI as a very precocious toddler, okay? It is phenomenal, the kinds of things that it can do. It's advanced. It jumps to giving you answers that are correct, and you're like, where did that come from? That's amazing. It's also still learning. And at this point, it's only as good as the people around it that are training it and trying to work with it and engage with it to try and say, okay, you're close, but not quite. Here's another data point for you to take into consideration. Oh, yep, you're getting closer. One more step. And it reminds me very much of just, you have to be in there parenting in a way and guiding it and trying to work with it. So it can do amazing things. It doesn't do them on its own. It does require the care and the constant feedback loop. Now, we did a project recently that was a very simple chatbot. I will tell you that I am really glad that we decided to have a quick pull-out plan because we actually enacted it. It started to develop its own biases, and at one point started responding with things that were like, wow. Let's pull it right now before that gets really ugly, because it actually was biased. And it, from the logic that you could see being entered into it, you could see how it thought that was the right answer, but it was a sliver of information and not the breadth of what it needed to learn. So we didn't have the full staff of people to sit there and continue to keep training over and over and over again and get it to the right space before we released it. So if you're in that space too, I'd say go cautiously. It might be that that company has put so much work into it already and it is far more advanced at this point, but just make sure that they actually have people in place to continue to monitor and work with it and train and engage with you to know if that's the right answers and the right things that it's delivering. You will definitely want to know what the intent is behind the technology. I'd say going back to that spectrum of risk, if the intent is just to deliver content, it might be a little less risky, depends on what the content is. But if it's intended to help kind of guide people or change behavior or influence them in some way, you're gonna definitely wanna take a little closer look at that. And you'll probably wanna do a pilot and spend some time really evaluating it. Our simple little chatbot, we put a month of pre-training into it and still had a biased outcome on certain, I think it was at least 3 questions that were pretty bad. But the team that was supporting it on the vendor side was a very small team as well. So they didn't have a scale of influence to keep going in and keep doing stuff on an active basis. That might not be the case with all vendors. Some vendors may actually have an entire engineering staff that are sitting there watching and training and working with you on a regular basis. If you have that, set up time with them. I know this is a big effort, but you may just want to get started until you're confident. Spend time with them. A lot of times on projects, we will spend a weekly meeting with our vendors just going through what's happening and discussing it openly and letting them know when we're not happy with results and when we need to make changes. Until you get to that level where you're confident with what it's doing, you're not going to want to just release it out there. But to that point, you want to make sure that before you get started, you have your, what do I want out of this? What's supposed to be happening out of that technology? And then evaluating what kind of criteria, or establishing what kind of criteria you want to use to evaluate it against. A lot of times we go into a vendor agreement hoping that it's going to solve our latest problems. And we haven't really quite articulated what those problems are. And we also haven't envisioned what the perfect solution or what the best case outcome would be. And you have to know those things and try to figure out some sort of objective evaluation so that you can actually have those conversations with the vendors to say, no, we agreed that it would do this, and it's not there. Can we get to this or not? Because if it can't, then I would like to take this moment to just pull back and not spend any more of your time and my time. But if it can, what's our plan of action to get there? But until you have those really objective things to evaluate against, it's just a feel. And unfortunately, I think people tend to go into technology with the feels all the time. I do it sometimes too, but then I try to back it up with something that makes sense, right? Am I just off left base, or is there actually something there? Again, I say start small, scale it up as you want to, but always start with a small group of people. I think we were lucky that something like one of the applications we have here was already being used with a small group of students we were able to see the outcomes and say, okay, it's a safe thing, it's a good thing, it's going to give us the value that we're hoping for. Let's go ahead and scale. And so you can always go bigger, but it's hard to scale back when you've started big and now you're trying to come back again. So just go at it small. The big things are going to be these smaller bullets at the bottom here. You're going to want to work with an established vendor. I know this is going to really hurt those startup companies, which are tons of them out there right now, but an established vendor who has not just broken into this space in the last few months. Those startup companies can do phenomenal things. They typically have a lot of funding. They're also very clunky at this point because they're still creating their actual system. If it's something that you just want to play with, you're starting small, you want to see how it's doing, maybe only sign up for a contract for 6 months. And at the end of the 6 months, if it meets those outcomes, then you'll look at renegotiating longer term. But don't go in with a 3-year contract, the most crazy force majeure type of break the contract clause, and hoping that it's going to just hit the ground running. If they haven't been in this space for long, at best they've spent maybe a couple years working in a small team trying to come up with something, and it may not meet all your needs. I would say only engage with ethical AI organizations. Those are the organizations that are transparent with how they're using the data, what type of data they're using, whether or not they share that information with other organizations, even if it's a research organization. They are working with people who are subject matter experts in the field if it's something that starts to develop into the clinical space. They are the people who are really trying their best to do a lot of that good work for you, and they're very open about it, and they're sharing it with you. Now, you have to be a little careful with that because they might look like, and that's the one vendor that didn't necessarily go through any regulation. They shared a bunch of information. Turns out that information was wrong, but at least they're taking a step in that direction, and I think that gives them a little bit of some credibility, and then you can talk through some of those things that don't make sense. You're going to want to know the process that they're using for any type of AI that they have. And you're going to hear people use the term AI just arbitrarily. And it could mean a whole spectrum of things, right? It could just be as simple as I ask a question, it responds back to me in some sort of human language form. It's considered part of AI. There's also things that are a little bit more intensive that are actually doing more calculations and doing more logic behind the scenes to do work with you. You want to know, depending on what that technology is, how they're training it. Again, do they have a staff of engineers who are sitting there making sure that the machine learning aspect is accurate? That if there's any bugs, if there's any issues with it, that they fix it and resolve it quickly? Or is it just it's the Popeil of technology, set it and forget it? Like, if that's the case, then you probably don't want to engage with them. But if they are actually actively engaged with it, try to know a little bit about that process. Establish the frequent check-ins, and then have that emergency backup plan. And trust me, any project that's going to be something that could throw you into a PR nightmare, you're going to want to have a quick backup clause. Even if you're starting simple and starting small, you want to make sure that you can pull the plug as quickly as possible. All right. I think I can cover this one for you.
Okay. Go ahead.
Yeah, no, I was going to say, so this next steps for us, we're in the beginning stages. I mean, even after a year, we are trying to pull it all together. We are trying to establish at least semblances of a governance and oversight. We're trying not to do it with the heavy hammer approach, but more of a collaborative approach. We want to give our colleagues the tools that will help them, not necessarily force them into something because we don't know what we don't know yet. We have established a community of practice that's just now forming, and again, it's going to be that network of people in that space that can come together on a monthly basis and share and help connect with each other. We are helping build that catalog of services and things that are being used on campus, because that isn't, we've started one, but it took us actually going through a little bit of legwork to get there. We want to take a closer look at our procurement workflows to see if there are opportunities for us to inject a little bit extra into that process. Maybe we can get a checklist in front of folks even with discretionary funding, that if it's in this business domain or this space, you have to fill out this, checklist of we did these things before you put your P card down. And we want to make a plan to intentionally engage with our students. I think we've been trying to do that all along, but we are now at the point where I think we need to start looking at those evaluation criteria and the outcomes. And I think the best way to get there is going to be working with our students to see, what is it that they're really struggling with right now, and is this technology doing what we need it to do? Do you have anything you want to add to that one?
Nope, that was great.
Okay.
I definitely want to hear, questions and thoughts from the audience. So I can't see very well because it's very dark for me, but I don't know if there are note cards. I'll grab those. I'm just going to divvy up some of these. We've got some good ones, some hard ones here. Okay. I'm going to start with one that relates to the checklist, and I want to try to get through all these, so we'll try to be quick and have some more dialogue today if we need to throughout the day. When you get a solicitation from a vendor, what questions should you be asking to determine whether you should even consider it? That's a tough one. I want to just start with this ownership question that you raised, Mary Jo and Jen. One of the challenges with the solicitations is that some of these products are hybrid products and they don't have an obvious home, right? So there's some hybrid clinical and non-clinical products, and so where you start and who asks the questions can look a little bit different. Do you want to say a little bit about the form?
Yeah, I was just going to say this was the intention behind creating a form, because I think what we, in addition to sort of the gap of learning or the gap of service, is there is just some basic things that had to do with privacy, accessibility. If it's a product that's ever been used in the college campus population before, it doesn't necessarily transfer. And so we can share that, for whoever wrote this question, we can share our initial intake form, but what it does is actually ask who is giving it. Is it a student? Because sometimes students are developing things. Is it an external vendor? What is the goal? Have it, and then ITS helped us with the exact verbiage of, does it meet these accessibility standards? Does it meet these privacy standards? That was sort of our baseline. If it got through those and it still looked like it was a need, then we would have the technology work team look at it and see, does it help us with one of those 4 themes that we already identified, which is the start of strategy. So, and that form, we sometimes joke, is an evolving form as we learn what better questions to ask. I think the other question we want to ask also is, are you currently working with someone on this campus someplace else? Because that's something that vendors don't typically do. So we will make sure that we get that form to you. It's also on our Student Life Technology Services webpage, and will also be on our Wellbeing Collective webpage, so that we can start to point people to that form, and then we can then review on a cadence. And Lindsey gave me great advice lately, because sometimes you just, people are trying to solve problems, they're very earnest, and it's okay to send an email and say, thank you so much for your interest in working with us. That's currently not a gap that we have.
Sorry if that was one of you.
It can be as easy as that. Yeah, that's hard to answer that one.
And so, gosh, there's so many good questions here. Any digital platforms you recommend that show sustained use, more than 1 to 2 logins? I don't think I'll comment on any specific vendors, but I would just say this question about engagement is super important, and I'm finding that it's a question I'm asking up front. In most of my conversations with vendors, I'm not having a lot, as many as probably Mary Jo, but I'm always asking, how do you measure engagement? Because there are often very high level observations or slides about what engagement looks like. Sometimes it's if you've logged in once in a month. Sometimes it's if you've logged in once in a year. And the other thing I want to say about engagement is that it's not just on the vendor or the student, it's also on us. I was thinking about this recently because in like the communication world, we sometimes talk about this like graveyard of hyperlinks that ends up on some of our web pages sometimes, and how we have to constantly maintain and attend to our web pages and websites. And I think the same thing is true with these apps. And I talked about this in the digital life cycle yesterday. Sometimes it's on us, right? I mean, if we adopt something and then we don't promote it, talk to students about it, and continually engage them, that's really on us. And our student population recycles sometimes as fast as 18 months. We have some master's programs that are 18 months, right? So we have to keep talking to students about things that we think are valuable and make sure they're valuable to them. Another question here, I don't have the answer to. Any data to indicate telehealth is better than in-person support? I mean, this is where we need a lot of research. There is a lot of heterogeneity in terms of what does therapy look like. One of my faculty colleagues I know has shared with me that he worries sometimes that counseling and mental health in general, and I'm saying this as a mental health clinician myself, is a little too self-styled, right? And when it's self-styled and highly individual and personalized, which I think is important, it does make it harder to measure and measure in a research context. But I think some of the more manualized approaches, like cognitive behavioral therapy, are going to be where you're going to see more data coming out about whether it's better. I can tell you, I mean, I think probably many of us have the experience of friends, family members who are getting help now over telehealth who wouldn't have gotten help in person. And that's just because, you know, if you have kids, if you have weather, if you have transportation issues, some is better than none in many cases, but the data is still emerging there. Mary Jo, do you want to take that one?
Yeah, this one says, how do you receive student feedback and ensure all students are heard? And I think this is a really important question because it is really easy to not or skip over this step. And so I think when we say engage student in all the processes, engage all student voices in the process. And there's several ways that we do that. We have right now just lifted off something called the Student Wellbeing Network. And that is not sort of your typical student leaders, but it's students who represent the diversity of campus. They was randomly selected, but really trying to get students who maybe aren't studying this, aren't going to major in this, but are experiencing campus and navigating campus and get their feedback. And we also have advisory boards across campus that represent different populations on campus that it's really important that we go to, ask them to be part of pilots, and make sure that that pilot data is representative of the campus population. So great question.
Jen, do you want to take that one?
Yeah. What do you see as the main reasons not to have data stored and sold to others if it is anonymous? That's a really good one here. I'm first going to point out anonymous. And in my experiences with vendors, anonymous could just mean that they've de-identified the individual. That doesn't necessarily mean that they can't identify a population of users. So a good example might be one of the apps we're working on right now with a vendor. Like, this is a lower risk item, but we can actually segment out our campus. So any use of that application, I know we can grab all of those use scenarios for University of Michigan students only. And then in there, I can also see what they're searching for, what types of activities they're engaging with the most. If that information were to get out to someone else, it's going to go to the intent of who's going to use that information. Are they using it because they want to deliver something else that's going to be more helpful as well? Or are they using it as a way to market something? Are they using it as a way to get in front of these students and try to get something in front of them? I just hesitate whenever we know that we can get to a population of people. It's something that you just want to be cautious about. Now, it may be that they can sell a population of information, but maybe they don't share a whole lot of detail other than generic usage. Like, we have this number of population of students who actively search for counseling services. Great, sell that away. And that could be something that maybe researchers are using at some sort of aggregate level to see just how trends are going with the students in those areas. But it doesn't give them anything that they could use any bad intent with. It's very nebulous, if you will. But I would say that even with anonymous, know what data is part of that anonymous and how they're planning on selling that back to anyone.
There's a question here about, do you worry that convenience will help people avoid human connection? This is a good, there's a lot I would want to understand about this question. And I will just say from my vantage point, and I shared some of my bias about this yesterday, but when 80% of the feedback that we get in our clinical systems is about time and really about convenience, it's a huge problem to solve. And I will say that my own experiences is that we create too many barriers to people getting the care that they need. And sometimes I think we get hung up on our old processes. And things that I have heard in my last 10 years are things like, we need to teach students how to navigate the healthcare system. We need to teach them to call us ahead of time and not walk in and wait on the phone for an appointment. We need to teach them how healthcare works. That is a valid viewpoint, but I think that that viewpoint has gotten us stuck in a way of doing things that is not focused on the student experience. You know, for students to wait hours to make appointments, to sit in a lobby for appointments, to wait, oh my goodness, the email back and forth about scheduling, and our counselors spending time emailing back and forth about scheduling. I do not think that is people working at the max of their skill set and making the maximum contribution to our student population. So I'm showing my bias here. I do not worry about this right now. Maybe when we have solved this time problem and this access problem for mental health care, I will worry about it more. But right now, I'm pretty excited in this one area, which is time and convenience, about technology as a way to make it easier to get care. That's me editorializing.
Yeah, I was just going to add one thing, I think, and this is my bias, is I feel it is important that any technology supplement or any technology service connects people to a real person if they want it. So it, right, is that there is an infrastructure at work. If somebody does want to sit down with somebody face to face, if somebody does want to have a connection to a particular office, is that, and part of the reason a customizable resource can be really important is that it does that. It increases access, increases convenience and efficiency, but it also doesn't pretend like it's doing it over here, that it brings it into the ecosystem of care. And I think that's one of the things that we have to do whenever we're adopting something, is putting it in the ecosystem and not like it's the thing that's gonna solve everything. I'm going to just read this next one. Yeah. This one is strategies to work towards increasing digital mental health innovations when the higher ed institution at large is resistant to change or a late adopter. I'm going to take a shot, but I'm going to have you, because I think you really talked about this. I think this is where the digital strategy in alignment with institutional priorities will be probably your strongest argument, is deeply understanding what the institutional priorities are, where are we headed, and are there some solutions that technology can help us with? instead of saying, look at this cool new tool, it may be the strongest to find out what are the institutional priorities, where are we headed, and where can technology supplement. But
Yeah, and I
Okay.
think that there's an important cultural element here that's being identified in the question, right? Which is that many institutions are more risk averse for all kinds of reasons, good reasons. You know, reputational risk. I mean, some schools are just never going to be out on the leading edge doing it the first time. They're going to want to see benchmarks. They're going to want to see peers doing it. They're going to want to see data. So, you know, if it's culture you're up against, that's a longer timeline and a longer process. I will just say my own experience with leading any kind of new services is to always start with data. And one of the things I think that happened and that I learned a lot about in COVID is one of my favorite words was that I use a lot now from one of my epidemiology friends is anecdata. And I think there's a lot of anecdata in general, and stories are important, and stories are a helpful hook to get people to care about something important. But stories are not a business plan, and stories are not going to persuade stakeholders to make major investments. You need to think about, if you're trying to convince stakeholders of the importance of something, think of it like a business plan and convince them why they should relinquish the hard-earned kind of tax and tuition dollars and take it from here and push it to somewhere else, because that's often what we're talking about. I mean, sometimes we get a windfall of funding and we get to go spend it on something new. But sometimes it has to be taken from somewhere else and applied over here. And then I think the bar gets higher, and you really need data to show that, you know, peer institutions, right? So we have a provost list of peer institutions at Michigan, and that's who our provost cares about. I don't know what the peer institution list is at your schools, but you should know. Sometimes we benchmark with the Big Ten, but sometimes not, right? Like it's an athletic conference, it's not the peer, it's not the provost peer list, so that's really important. Okay.
You know what's one of the interesting things that I see? When I heard the question about innovators or innovations, maybe it's semantics, but I see the university, at least the University of Michigan, being very supportive of innovation, but maybe not necessarily a full transformation. We tend to be very risk averse. We tend to be a little bit more of a, okay, I'm going to try this out because it looks like it has promise. And I haven't had much pushback on actually dabbling in innovative things. I think it has more to do with making that full big transformation leap and suddenly going from a very reactive, like we are here to help the patients when they come to us first, to one that's a little bit more ahead of the curve and proactive and really is trying to get into that wellness space. And I think that touches on your culture comment about like the best strategy is going to be training with the data and the information and sharing and educating folks if we want to make that big leap and make that transformation. Everybody has to see the same information and come to that table with a good understanding of, yes, we need this before we're going to be able to make that leap. But I don't know that we've ever not been innovators. This is kind of like the core of the culture here.
Do you have another one?
Yeah. Are you willing to share your internal evaluations of these products? Ooh, I think we could share anonymous, de-identified, like non-company specific evaluations.
It's interesting though. It's I think of some of my experience with emergency management and emerging public health threats, and in the emergency management world, they're really good about doing what are called after action reports, and kind of metabolizing the experience and summarizing it for the future, and so you can pull it off the shelf and learn, right? So we've done that with H1N1 years ago and COVID, polar vortex a couple of years ago, but I don't know that we have that built kind of into our workflows and processes, but that might be something to think about.
Most of our projects do.
That's good.
Yeah, we do either a lessons learned or a summary report to just kind of close the loop on it. But
Perfect. there's a quick question here about the name of the therapy platform we've contracted with. That's publicly available, so you can look at that. Just to avoid any conflicts of interest, I'm not going to mention any specific vendors, but it is publicly available. And I think from a process standpoint, it's important to think about the ways that some of these vendors come to you. In Michigan, we have the Michigan Association of State Universities, and some of these products come to us through MassU. And the benefit we have in being connected to MassU is that they create kind of a buying consortium for us, and there can be some better pricing and terms, and kind of a community of practice that comes with that, because the vendor we've gone with is also the same vendor that Michigan State University and Western Michigan are using, right? So then we immediately have a peer group that we can kind of iterate with and learn from. I've got a tough one here, but it's an important one. It's, do you have concerns about the use of digital tools reducing investments in college counseling centers? What's your advice to prevent that and advocate against it? I can't answer really from any other perspective except from the U of M perspective, but I think there will always be a need for an in-person resource that has local expertise and knows the experience of our students. So I think of it as an and not an or, and that's the Michigan perspective. I cannot speak for other, maybe more cost-conscious, resource-constrained environments. I can imagine that when a vendor comes to them and says, you're doing counseling for X dollars, same for psychiatry, by the way, this is how much it's costing you to do it now, well, we can do it for less. I mean, how enticing is that, right? And that gets back to the really, really important role of having a way to evaluate these programs. And I just do not think that these evaluation tools are in the hands of decision makers, because sometimes the vendors go straight up to the top, straight to the president, straight to the VP of Student Affairs. Sometimes it comes at a sideways. We really need a way to evaluate these products, and that's why I will keep coming back to quality and value. If we do not have a definition of quality and value, we cannot talk about it in a way that our stakeholders understand and appreciate. So I don't have that concern. It's an and, not an or here at Michigan. We need to learn new ways of doing things. As Daniel Eisenberg and Sarah Abelson pointed out yesterday, we have not cracked the code on solving the mental health problem, okay? So we need to do some things differently. That might include counseling centers and health centers doing some things differently. And that's why I think upskilling and training the next generation of counselors, psychiatrists, et cetera, is really critical. And I don't have any idea what's going on in our training programs to upskill people and get them used to blended models, but man, we need to be thinking about that. Because I think if we get more and more out of step with what students want and how they want to interact with us and the convenience that they care about so much, they are gonna vote with their feet, and they already are. Many of our students now at Michigan, at least 50% of our undergrads are from the state of Michigan. Many of our students are not coming to counseling anymore here because they're holding on to their home counselor because they can see the counselor they've been seeing as a high school student over virtual therapy. And why wouldn't they, right? That relationship is really, really important. So we need to be thinking about some different ways of doing things. So it's different, it's an and, not an or for me. But if you're in a more resource-constrained environment, start thinking about this value question and how you're going to communicate this to your stakeholders, because they will start knocking on your door asking.
I would just add on to that, one of the comments in one of the earlier slides about having a champion. Yeah. One of the conversations that we've had sort of informally internally here is the idea of someone who owns that technology. And at this time, it's in your best interest for a larger scale application to have someone in addition to your counselors who's helping you manage that tech. Now, it's possible that you could have some apps that don't require that sort of rigor, but like we mentioned, we hired somebody now because the technology has actually become more complex to manage that particular platform. It's entirely possible that down the road you might find that you're going to start saving money, but it's also possible that you might find that you need to actually inject another chunk of change for another body to help you manage the tech and maintain it and monitor how it's going and if it's effective and meeting the needs. And we do that even in our central IT department, where we have what we call product managers or service owners, and their sole job is to try and monitor that technology to make sure that it's effective and it's used appropriately and that we're covering our bases. So maybe it shifts the budget, maybe it's an additional budget, but it's not an easy answer right now, and I would say that you're not going to be cautious if the vendor says we're going to save you a ton of money right now. Depending on what the technology is, that might not be the case.
I think we have 2 minutes left. Are there any other last minute questions before we close? Go ahead. Hey, Chris.
Has thoughts on how to do that in a larger way so that individual schools aren't reinventing the wheel and really having to be pretty sophisticated in the sense of navigating some pretty savvy salespeople and some very savvy tech people, but maybe not people who always have the best interests of students at heart and are really working in a for-profit environment.
Well, gosh, this makes me think again of that talk yesterday with Daniel Eisenberg and Sarah Abelson and the analysts they're working with, and the idea of crowdsourcing. That would be great. That'd be a big time saver. And, you know, short of a sort of centralized repository for that kind of data, it does speak to, I think, the importance of a community of practice and benchmarking. I mean, you know, we've got our Big Ten directors listserv that we lean on a lot. There are other peer institutions that we lean on a lot. But I think it's important to, this, you know, and it speaks to the benefit of national organizations, right? And being able to have people you can email and say, hey, can we talk about this vendor and how did you guys decide to go with this person and not this person? I have found colleagues really willing to share and be very candid in their approaches and how they landed. So that's, but I'd love to explore that idea.
And I think we should. The only reason that I tend to tread cautiously is if we are working with a vendor today and we already have existing contracts, we may want to talk to our Office of General Counsel first before we share any sort of, you know, open conversation or feedback that might get us in trouble. But any of the vendors that we decided to go against, we could absolutely share information with you.
I also think, Chris, we could start to be more transparent about what we're looking for and what we need. Mm-hmm. Because I think every campus is different, right? They have private, public, large, small. But I do think we could, as we're learning more, say what we're looking for and what the important things are to look for as a start before we start sharing that. So I do think there's some steps we could take to move in that direction that could be helpful for everybody in the field.
I want to thank all of our panelists. Give them a round of applause, please. Thank you so much. And remember to fill out your evaluations. The next sessions start at 10:45. They'll all be on the 4th floor today.